This is a phase 3 randomized open-label study, including patients with untreated stage 4 non-small cell lung cancer with absence of EGFR, ALK, and ROS alterations, and with a good performance status. Patients were randomized to 2-to-1 randomization to receive pembrolizumab in a subcutaneous formulation, 790 milligrams every 6 weeks, versus pembrolizumab IV 400 milligrams every 6 weeks in combination with platinum-based chemotherapy according to the subhistological subtype. Patients received up to 16 cycles of pembrolizumab, and the trial had two dual primary endpoints, two PK endpoints, the cycle 1 area under curve, and also the steady state at cycle 3. Yes, in the trial, 377 patients were randomized, 251 received pembrolizumab sub-Q, and 126 pembrolizumab IV. It's important to stress that for those patients receiving pembrolizumab sub-Q, the median injection time was only 2 minutes for a 4.8 milliliters volume. So overall, patient demographics were well balanced between the two treatment arms. Perhaps to highlight that 66% of the patients included had non-squamous histology, 33% of the patients squamous histology, and approximately 40% of the patients had tumors with PD-L1 negative staining. So it's important that the study is positive. The study was positive for the two dual primary endpoint. This was a non-inferiority trial, trying to find that sub-Q was non-inferior to IV with a pre-specified non-inferiority margin, geometric mean ratio of 0.8. So for the cycle 1 area under curve, the geometric mean ratio was 1.14. For the steady state at cycle 3, the geometric mean ratio was 1.67. So in both cases, above the pre-specified non-inferiority margin. I think it's important also to analyze the results from an efficacy endpoint. So in the study, the median PFS with pembro sub-Q plus chemotherapy was 8.1 months. With pembro IV plus chemotherapy, it was 7.8 months with a hazard ratio of 1.05. So overall, very similar results in efficacy, in PFS, also in overall response rate, that was 45% for those patients treated with pembrolizumab sub-Q versus 42% response rate for those patients treated with pembrolizumab IV. Similar median duration of response, 9.1 months for pembrolizumab sub-Q, 8 months for pembrolizumab IV, and also no differences in overall survival that was immature, was not reached in any of the treatment arms, and the hazard ratio was 0.81. And also, we presented adverse events that were really similar between the two treatment arms. So grade 3 to 5 treatment-related adverse events in 47% of the patients in the two treatment arms, and also 8% of the patients discontinue pembro sub-Q or IV. So exactly the same percentage of patients discontinue the treatment. And when we analyze the injection site reactions, only 6 patients had any injection site adverse event. These represent 2.4% of the patients, and in all cases were grade 1. No, I think the trial is a positive trial that demonstrated that pembrolizumab sub-Q was non-inferior to pembrolizumab IV. It's important also to say that the response rate, PFS, and duration of response were consistent between the two treatment arms, pembrolizumab IV and pembrolizumab sub-Q. when we analyzed the toxicity for pembrolizumab subQ plus chemotherapy, was manageable and consistent with the toxicity with pembrolizumab IV. And also, the injection site reactions were infrequent, mild, and non-serious. It's important to say that the median injection time for pembrolizumab subQ was only 2 minutes, and in my opinion, pembrolizumab subQ is a treatment option in all indications where pembrolizumab IV can be used. Yes, I think it's important to acknowledge and to thank the patients and their families, and also all the investigator sites, and also that we are really pleased that the results of the trial were published simultaneously with the presentation at ELCC in Annals of Oncology. Thank you.